Hi, I'm MiKayla Christensen, and I'm a physical therapist.
And I'm LaNita Mortenson, also a physical therapist.
And today we are going to be talking about pelvic floor rehab, which includes bowel and bladder dysfunction, pelvic pain, as well as pelvic organ prolapse. On the topic of bowel dysfunction, we also see this in the clinic, either bowel incontinence or the uncontrolled leakage, or constipation. And signs of constipation would include straining more than 25% of the bowel movement, having fewer than 3 bowel movements per week, a sensation of incomplete emptying, or often the stool consistency is lumpy and oftentimes very hard. These are intimately related with urinary patterns, so oftentimes when we're treating one in the clinic, we're treating the other.
On the subject of urinary incontinence, that includes urgent continence, where it's an overactive bladder, where you can have the urgent need to go, where you put the key in the door, or sometimes where you've done some dysfunctional voiding, where you're going just in case, you're straining to go, things like that. So we're causing a problem with our bladder and not letting the bladder fill completely. We also look at stress incontinence, which can be where you're leaking with laughing, coughing, sneezing, or you can have a mixture of both incontinence.
So regarding pelvic pain, in the clinic we'll often describe this as pain in the lower abdomen, the pelvis, or the perineum. It can be chronic, which means it's been going on for a few months at a time. It could be recurrent or even acute in nature. It's often associated for females prenatal or postpartum, and it can be very functionally limiting, oftentimes limiting the ability to sit for prolonged periods of time, driving prolonged periods of time. Sleeping can be affected. Penetration, either sexual or with a gynecological exam, is often difficult and challenging. And then there's also the relationship between the bowel and the bladder dysfunction as well. Why is it important to seek help for bowel and bladder dysfunction and pelvic pain? This is huge. We find that there's a sense of embarrassment or shame often from individuals, which leads to poor self-esteem. Depression and anxiety increase dramatically. There's a financial strain, relationship problems develop, there's a strain with those connections, and there's an even 2 times greater risk of admission to a nursing home if you're dealing with incontinence. So we want you to know that you don't have to suffer in silence, and we at GRHS are here to help.